Robert, can you tell me what's involved in vetting a yearling at the sales for a client?
The vetting process actually takes 3 stages. The first one's the clinical exam on the yearling. The second one, we use the endoscope to have a look at the horse's respiratory and breathing apparatus. And then finally we get a set of the horse's x-rays and have a look at all the joints there.
So what are you listening out for?
And what we're looking for here is any signs of arrhythmia, an abnormal rhythm, an abnormal rate. So he's got a heart rate of 38 beats per minute, everything sounds normal and exactly as we'd want it. We're looking here for things such as cataracts, exactly like human patients may have. So we'll just have a look, you can look at the surface of the eye and then deeper into the back of the eye onto the retina.
Hold still, buddy. So what's next?
So my client's hopefully buying this horse with a view to being a champion and one day a future stallion. So the next stage is to have a feel at his reproductive organs and his testicles. Okay. We want there to be 2 there.
And do you need me to do this one too?
Yeah, why not?
Oh boy. Yep, they're definitely both there. So we've done the heart, eyes and testicles. What's the next step?
The next stage is actually starting to feel his legs. So the key things we're looking for here are to carefully palpate the joints, the tendons and the ligaments, just looking for any signs of lumps, bumps, heat, inflammation. So now what we're going to do, we're going to pop the scope up his nose and have a look at his larynx, essentially the equivalent of the human voice box. Horses are great athletes, but if there's a problem with that part of their breathing apparatus, it can be really limiting when it comes to their performance on the track. The more they open up, the more air the horse can get in there, and effectively the better an athlete he should be. His looks excellent, yeah, so he's a pass for me. So this is the final part of our vetting. All the yearlings here at the sales will have had x-rays taken already. We're trying to assess the joint and see if there's any abnormal areas of new bone or any little chips or fragments within the joint itself.
So essentially, do you pass or fail a horse to your client?
Sometimes it comes down to that. Obviously in a lot of circumstances they're paying a large amount of money for these yearlings, so anything that we find that we're just not happy with, we make that available to them, and then it's sort of their decision on the balance of probability, whether it's something they want to go ahead with and buy or whether it's too risky for them.